Most people with diabetes are told to be careful with fruits, especially citrus. They're labeled too sweet, too acidic, or even dangerous with medication. But here's the truth. Not all citrus fruits are the same. In fact, three specific citrus fruits have been shown to lower fasting blood sugar, improve insulin sensitivity, activate GLUT4 transporters, reduce nerve pain, protect kidney filtration, and even calm appetite hormones like ghrelin. These fruits work with your metabolism, not against it. They don't just avoid sugar spikes, they help fix the root problems behind high A1C, inflammation, and fatigue. In this video, you'll discover how to use these fruits safely, when to eat them, what portions work best, and one powerful pairing trick that transforms each bite into healing medicine. And the third fruit? It has a reputation for being too sweet, but it might be the most underrated fat-burning citrus in your kitchen. First on the list, lime. Lime might be the smallest citrus fruit on the grocery shelf, but for someone managing diabetes, it can be one of the most powerful healing tools in your kitchen. At first glance, it looks like a garnish, something you'd squeeze over tacos or drop into water for flavor. But if you look deeper into what this little green fruit actually does inside the body, especially for people with high blood sugar, you'll discover it's not just a tangy accent, it's metabolic medicine. One of lime's greatest strengths is that it combines several mechanisms that work together, not just to lower blood glucose in the short term, but to reduce insulin resistance over time. When consumed regularly, especially in its fresh, unprocessed form, lime supports your pancreas, muscle glucose uptake, nerve protection, kidney filtration, and even hormonal balance, all without the sugar content found in most other fruits. Let's begin with the blood sugar impact. The glycemic index of lime juice is approximately 20, which is extremely low. But more importantly, its glycemic load is almost zero when consumed in small amounts, like 1 to 2 tablespoons of fresh juice or a wedge squeezed onto food. This makes lime one of the few fruits that can be added to any meal without raising blood sugar, even when eaten with carbs. In fact, it slows the blood sugar rise from carbohydrate digestion. This happens because of lime's high citric acid content, which has been shown in research to inhibit alpha amylase and alpha glucosidase, two key digestive enzymes that break down starches into sugars. When these enzymes are slowed, glucose enters the bloodstream more gradually, giving your body more time to release insulin without spiking. That's why people who add citrus juice to meals often report smaller blood sugar spikes, especially after rice, pasta, or bread. But the benefits of lime extend far beyond digestion. One of the biggest hidden powers of this fruit lies in its polyphenols, particularly two compounds called hesperidin and eriocitrin. These are powerful antioxidants that activate the AMPK pathway inside your cells. Why is this important? Because AMPK is like a master switch for energy metabolism. It tells your cells to burn fat, use glucose more efficiently, and reduce inflammation. In type 2 diabetes, this pathway is often disrupted, but hesperidin, found in lime peel and juice, helps restore it. When AMPK is active, it enhances insulin sensitivity, meaning your cells become more responsive to insulin and can absorb glucose from the bloodstream without overworking your pancreas. One more benefit, lime polyphenols increase GLUT4 expression in muscle cells. GLUT4 is the key transporter that shuttles glucose from your blood into your muscle tissue for energy. In people with insulin resistance, GLUT4 becomes sluggish, but studies have shown that flavonoids in citrus fruits like lime can reactivate this pathway. When GLUT4 works better, your muscles absorb more sugar after meals, leaving less glucose floating in your bloodstream to cause damage. This improves not only short-term blood sugar levels, but also long-term A1C values. Nutritionally, a single fresh lime offers around 22% of the daily value for vitamin C, along with modest amounts of potassium, magnesium, calcium, and soluble fiber if you consume the pulp. Each of these nutrients plays a role in diabetes healing. Vitamin C fights oxidative stress, which is one of the silent drivers of diabetic complications like nerve damage, neuropathy, kidney inflammation, nephropathy, and blood vessel damage, vasculopathy. Potassium helps regulate blood pressure and improves kidney filtration, Two essential benefits for anyone concerned about diabetes-related hypertension or kidney decline. Magnesium is especially important, as many people with type 2 diabetes are chronically deficient. Low magnesium impairs insulin signaling, raises inflammation, and contributes to nighttime leg cramps. Getting even a small amount from lime juice combined with other magnesium-rich foods can close that deficiency gap. Now here's something most people don't know. Despite its sharp, sour flavor, lime is actually alkalizing in the body. That's right. It may taste acidic, but once digested, its citric acid is broken down into bicarbonate compounds that help reduce the acid load on your kidneys and bladder. This is important because diabetics are at higher risk of metabolic acidosis, especially if kidney function is impaired. Alkalizing foods like lime help reduce this burden, easing kidney inflammation, and even protecting against urinary tract infections, which are more common in people with poor glycemic control. Let's talk hormones, specifically ghrelin and leptin, which regulate hunger and satiety. Research shows that polyphenol-rich citrus fruits can help balance these hormones by improving insulin sensitivity and reducing visceral fat. This hormonal shift can reduce cravings, flatten appetite spikes, and even improve sleep quality. That's one reason why a small lime-infused drink in the evening may help stabilize not just your blood sugar, but your metabolism overnight. And here's a myth buster. Many people believe lime juice is too harsh for the stomach or teeth, but this only becomes an issue when consuming undiluted lime juice in large amounts. When diluted in water or added to food, it actually aids digestion by stimulating bile flow and stomach enzymes. It also helps break down fats more efficiently, which is useful if you're consuming higher fat meals for glycemic control. A quick fun fact: lime was once considered green gold in the British Navy, not just because it prevented scurvy, but because it reduced kidney stones and uric acid buildup during long voyages. Today, researchers are revisiting this traditional wisdom and finding that citric acid from lime can reduce calcium oxalate crystallization, helping prevent kidney stones in diabetics, a surprisingly common but often overlooked complication. So how should you use it? For most people, one whole lime per day, equivalent to about 2 tablespoons, 1 ounce, of juice, is a safe and effective therapeutic dose. You can squeeze it into warm water in the morning, mix it into salad dressings, add it to grilled meats and vegetables, or even stir a few drops into a chia water drink for extra glucose stability. If you want a functional recipe, try this. Mix 1 tablespoon of lime juice with 1/2 teaspoon of ground flaxseed and a pinch of cinnamon and 1 cup of unsweetened almond milk. Drink it mid-morning or 30 minutes before a carb-rich meal. It helps reduce the glycemic impact of that meal by slowing absorption and activating insulin pathways. Here's a smart tip. If you plan to use lime daily, choose organic limes when possible, especially if you're zesting the peel. Lime zest contains the highest concentration of polyphenols and essential oils, but conventional limes may have pesticide residues. Always wash thoroughly or peel if in doubt. An important word of caution: if you're taking statin medications or drugs metabolized by liver enzymes like CYP3A4, excessive lime or grapefruit intake can interfere with drug metabolism. While this is rare with small amounts of lime juice, it's best to space your lime consumption at least 2 to 3 hours away from your medication and consult your doctor if unsure. So next time you walk past the citrus section, don't just reach for the usual orange. Pick up a few limes and treat them like what they really are: powerful blood sugar allies. In the right dose and paired with the right foods, lime doesn't just decorate your plate, it transforms your metabolism. Coming up next, we'll explore a citrus fruit that's often feared by diabetics, but has been shown in research to lower insulin resistance, support fat loss, and even protect your blood vessels. Stay with me. This one might surprise you. Second on the list, grapefruit. Grapefruit is one of the most misunderstood fruits in the diabetic world. Its sharp, slightly bitter taste and long-standing reputation for interfering with medications often cause people with type 2 diabetes to steer clear. But here's the surprising truth. When used correctly and in the right form, grapefruit can actually enhance insulin sensitivity, lower fasting glucose, reduce belly fat, regulate hunger hormones, and protect the fragile vascular system that's so often compromised in diabetes. Despite its sweetness, grapefruit maintains a low glycemic index of about 25 and a glycemic load of just 3 to 4 for half a fruit, making it a safe, blood sugar-friendly option, especially when consumed with its fiber-rich membranes intact. What gives grapefruit its healing edge is its exceptional flavonoid profile, especially a compound called naringenin. Found primarily in the fruit's pulp and peel, naringenin doesn't just act as an antioxidant, it works like a metabolic switch. Research shows it activates the AMPK enzyme, the same metabolic pathway targeted by the popular diabetes drug metformin. When AMPK is activated, your body becomes more insulin sensitive, burns fat instead of storing it, and increases its ability to move glucose from the blood into muscle cells. In fact, one clinical study found that people who consume grapefruit before meals experience up to a 17% improvement in insulin sensitivity over 12 weeks. Another trial showed a 13% drop in fasting blood glucose in overweight individuals with insulin resistance who added grapefruit to their daily routine. These aren't minor effects. They're evidence of how grapefruit subtly retrains the diabetic metabolism. But grapefruit's benefits go far beyond blood sugar numbers. It plays a powerful role in the hormonal harmony that diabetics often lose. One of its quiet strengths is reducing levels of ghrelin, the hunger hormone that drives intense cravings, especially after poor sleep or glucose crashes. At the same time, compounds in grapefruit improve leptin sensitivity, which helps your body recognize satiety, preventing overeating and stabilizing your appetite across the day. This hormonal balance can reduce binge tendencies, stabilize post-meal energy dips, and support deeper nighttime sleep, which is crucial for blood sugar regulation. In fact, when consumed in the evening, grapefruit may help blunt the natural cortisol spike that tends to raise glucose levels in the early morning hours. A common frustration for people with type 2 diabetes. Nutritionally, half of a medium grapefruit, about 120 grams, delivers approximately 38% of the daily value for vitamin C, 8% for potassium, 6% for fiber, along with small amounts of calcium, magnesium, and vitamin A precursors, particularly in pink or ruby varieties. This antioxidant and electrolyte combination is a metabolic gift for diabetics. Vitamin C fights oxidative stress, reducing damage to delicate tissues like the retina and peripheral nerves, which are highly vulnerable in diabetes. Potassium supports kidney filtration and eases vascular tension, helping lower the risk of diabetic hypertension. Magnesium enhances insulin receptor function and nerve signaling, while even trace amounts of beta-carotene from red grapefruit protect vision and help prevent diabetic retinopathy. Together, these nutrients support long-term resilience in the organs most affected by high blood sugar. One of the most fascinating effects of grapefruit happens at the cellular level. Naringenin boosts the activity of GLUT4 transporters, the specialized proteins that shuttle glucose from your bloodstream into skeletal muscle. But here's the advanced twist. Grapefruit enhances GLUT4 activity in muscle tissue more than in fat tissue. That means instead of storing excess glucose as abdominal fat, your body begins using it as clean energy for muscles, reducing both blood sugar levels and fat accumulation over time. This is especially important for seniors or sedentary individuals whose muscles tend to lose insulin sensitivity with age. Another little-known benefit of grapefruit lies in its subtle effect on adiponectin, a fat-burning hormone typically low in people with type 2 diabetes and abdominal obesity. Grapefruit increases adiponectin levels, encouraging your body to break down fat more efficiently while also reducing liver fat storage. In a 12-week human study, participants who ate half a grapefruit before meals lost 1.3 inches from their waistlines, without changing anything else in their diet. Grapefruit even offers help for diabetics dealing with nocturia or frequent nighttime urination. By helping flatten evening glucose fluctuations and reducing stress hormone release overnight, grapefruit supports better sleep architecture and bladder control. Its calming aroma also supports melatonin pathways, as confirmed in sleep trials where even the scent of grapefruit reduced anxiety and enhanced restorative sleep. For diabetics struggling with blood sugar dips and bathroom interruptions, this natural citrus reset could make a noticeable difference. And if you're worried about the sugar, A typical half grapefruit contains only about 8 to 9 grams of total carbohydrates, with 2 to 3 grams of fiber, bringing the net carb count to around 6 grams, well within the safe range for most diabetics, especially when paired with protein or healthy fat. Let's bust one common myth. Many people believe grapefruit is universally unsafe for diabetics because it interacts with medications. The truth is more nuanced. Grapefruit inhibits the CYP3A4 enzyme in the liver, which can affect the metabolism of certain drugs like statins, calcium channel blockers, and some antidepressants. But this doesn't apply to everyone, and most people with diabetes who are not on these medications can consume grapefruit safely. Even for those who are, the interaction is dose and timing dependent. If you're on one of these drugs, a simple solution is to separate grapefruit consumption by at least 8 hours from your medication, such as eating it at breakfast and taking your medication at night. As always, consult your pharmacist or provider before making changes. For best results, stick to half of a fresh grapefruit per day, about 4 to 5 ounces. Eat it whole with membranes intact, not juiced or canned. The fiber in the pulp slows glucose absorption and delivers sustained antioxidant release throughout digestion. Want to take it further? Sprinkle cinnamon on your grapefruit slices. This combo enhances insulin receptor activity and adds anti-inflammatory benefits. For a refreshing metabolic salad, combine pink grapefruit segments with avocado, crushed mint, and a handful of spinach, dressed with olive oil and lime juice. This not only stabilizes the sugar impact, but enhances liver detox, digestion, and gut microbiome support. Here's a powerful tip. Even the zest of grapefruit peel contains bioactive oils like limonene, which support bile flow and help the liver break down excess sugars and fats. A small amount of grated zest added to salad dressings or teas can offer a metabolic bonus. Just make sure to wash the fruit well and choose organic when possible. And here's a gentle word of caution. Avoid pairing grapefruit with fried or high-fat meals, especially at night. While grapefruit stimulates bile flow and digestion, combining it with heavy foods can overload the liver and impair blood sugar balance. Use it with lighter meals, lean proteins, or plant-based dishes for optimal effect. So next time you walk past this slightly bitter, pink-skinned fruit at the store, don't skip it. Grapefruit isn't just a breakfast side. It's a metabolic enhancer, a fat-burning assistant, a nerve protector, and a hidden secret for hormonal and vascular balance in people living with diabetes. Used wisely, this citrus ally can help unlock better energy, deeper sleep, more stable sugar levels, and long-term protection for the systems that matter most. Coming up next, we explore a citrus fruit that's beloved across the U.S., but often misunderstood in diabetes circles. Yet with one simple fiber trick, it can become your daily weapon for lowering blood sugar naturally. Third on the list, oranges. Oranges are often treated as the forbidden fruit for people with diabetes. Their bright, juicy sweetness triggers an automatic assumption: too much sugar. And yet, when you step past the fear and look at the actual science, certain varieties of orange, especially Navel and Cara Cara, can become powerful allies in regulating blood sugar, improving insulin sensitivity, reducing inflammation, and protecting the very systems that diabetes tends to wear down: the heart, nerves, kidneys, and digestion. The secret lies not just in their vitamin C, but in a sophisticated blend of plant compounds, fiber, and antioxidant molecules that work together to lower blood sugar, not spike it. Let's start with the basics. Despite their sweet taste, both Navel and Cara Cara oranges have a glycemic index of around 40 to 45 and a glycemic load of just 5 to 6 per medium fruit. That places them safely in the low to moderate category for diabetics, especially when eaten whole, not juiced. What makes these specific varieties special? Navel oranges are seedless, easy to portion, and have a consistent sugar-to-fiber ratio. Cara Cara, the pink-fleshed cousin, contains a unique type of carotenoid called lycopene, typically found in tomatoes, offering a powerful anti-inflammatory and blood vessel protective edge not found in standard oranges. Both varieties also contain hesperidin, a citrus flavonoid that has been shown to improve endothelial function, lower blood pressure, and protect blood vessels from oxidative stress, all of which help slow the progression of diabetic vasculopathy and neuropathy. Nutritionally, one medium orange, about 130 grams, provides approximately 78% of the daily value for vitamin C, 9% for fiber, 7% for potassium, 6% for thiamine, vitamin B1, and 5% for folate. Vitamin C is essential not just for immunity, it helps protect nerve endings from damage, reduces the glycation of proteins, and even supports wound healing, a major concern in advanced diabetes. The fiber, about 3 grams per orange, slows digestion, blunts glucose spikes, and feeds gut bacteria that play a role in appetite control and insulin sensitivity. Potassium helps regulate blood pressure, which in turn protects your kidneys from overfiltration damage. And thiamine is often overlooked but critical. It supports nerve impulse transmission and prevents diabetic peripheral neuropathy from worsening. What happens at the cellular level when you eat an orange is where it gets interesting. The hesperidin and other polyphenols present in the peel and pulp have been shown to stimulate GLUT4 expression in muscle tissue. GLUT4 is the transporter that pulls glucose out of the bloodstream and into cells, especially skeletal muscle. In type 2 diabetes, GLUT4 becomes less active, but citrus flavonoids help resensitize the insulin receptors that trigger GLUT4 activity, making your body better at absorbing glucose after meals without overproducing insulin. Think of it as a gentle, food-based nudge that teaches your body how to process sugar more effectively over time. But oranges aren't just about sugar control, they're also about hormonal balance. The scent alone has been studied in aromatherapy research and shown to reduce levels of cortisol, the stress hormone that spikes blood sugar when left unchecked. Additionally, the natural sugars in oranges come bundled with fiber and plant alkaloids that stabilize leptin and ghrelin, the hormones responsible for hunger and fullness. That's why eating a whole orange leaves you more satisfied than drinking orange juice. There's less rebound hunger and your brain receives stronger satiety signals, especially when the orange is paired with a handful of nuts or a small protein. There's also a unique synergy happening with the carotenoids in Cara Cara oranges. Unlike regular navel oranges, these pink-fleshed varieties contain lycopene and beta-cryptoxanthin, compounds that reduce oxidative damage inside arteries, support macrophage regulation, and lower levels of interleukin-6, a pro-inflammatory marker elevated in type 2 diabetes and obesity. These antioxidants don't just protect your heart, they also cross the blood-retinal barrier, offering protection against diabetic retinopathy and vision loss by stabilizing the delicate capillaries in the eyes. Here's a fun fact. The pith, the white stringy membrane inside the orange peel, is one of the richest sources of rutin, another citrus compound that reduces capillary fragility, prevents varicose veins, and supports circulation. Most people peel this part away, but in reality, it's where much of the healing power is concentrated. Diabetics with cold feet, tingling limbs, or poor wound healing may benefit greatly from preserving more of the orange's natural structure. And here's a common myth we need to debunk. Oranges are just sugar. While it's true that a medium orange contains around 12 grams of total carbohydrates, about 3 grams of that is fiber, and the rest are natural fruit sugars that are slowly absorbed. Not refined sugars. In fact, oranges are shown to improve lipid profiles, lower triglycerides, and even enhance HDL cholesterol over time when eaten whole. That's because of the hesperidin and pectin, the same compounds that give the fruit its structure, also bind bile acids and remove excess cholesterol. For a blood sugar-friendly, functional snack, try this simple recipe. Peel and slice one Cara Cara orange into rounds. Sprinkle lightly with ground cinnamon, crushed pistachios, and a small pinch of sea salt. The cinnamon helps regulate insulin signaling, the healthy fats from pistachios slow sugar absorption, and the salt enhances the natural citrus sweetness without needing any added sugars. One serving costs about 60 cents to 80 cents, and the flavor profile is so refreshing it can double as a healthy dessert. Want to go a step further? Use orange zest. Just a small amount of the finely grated peel can be stirred into tea, salad dressings, or oatmeal. The zest contains volatile oils like limonene and citral, which stimulate liver enzymes responsible for detoxifying excess glucose and reducing lipid buildup. These oils also support digestive bile flow and may improve fat metabolism in people with insulin resistance or fatty liver disease. An important heads up, while whole oranges are beneficial, avoid commercial orange juice or even 100% juice when managing blood sugar. 1 cup of juice may contain the sugar of 3 to 4 oranges, but none of the fiber or structure that slows glucose absorption. If you want the juice, squeeze it yourself and dilute it 50-50 with cold water and add a pinch of chia seeds or psyllium husk to recreate the fiber matrix. Here's one final precaution to keep in mind. Oranges are acidic, and while this benefits digestion, some diabetics with acid reflux or gastroparesis may need to consume them with other foods rather than on an empty stomach. Eating oranges with a protein or fat source, like cottage cheese or nuts, can buffer this acidity and support more stable blood sugar and digestive comfort. So the next time you pass by the citrus aisle, don't just look past the orange because you heard it's too sugary. When chosen carefully and eaten the right way, Navel and Cara Cara oranges aren't just safe, they're deeply therapeutic. They heal blood vessels, stimulate GLUT4 for better sugar absorption, protect your nerves and eyes, balance appetite hormones, and offer a powerful burst of antioxidants to help your body resist the slow, cellular damage caused by high blood glucose. And now that you've discovered the truth about these 3 citrus powerhouses, lime, grapefruit, and orange, it's your turn to make them part of your daily diabetes strategy. Which one will you try first? If you found this helpful, give this video a like, share it with someone managing diabetes, and don't forget to subscribe for more science-backed tips to lower blood sugar naturally.